On page 22 of your handbook, there's information about breaks and meals, and it's important that meals are taken based on the client's schedule. So if they're eating, it's okay that we brought our lunch if we're in a private duty situation and we're eating when they eat, or if they're taking a nap. But we're never supposed to leave the premises for meals or breaks or anything of that nature. Again, we don't want to leave our patients unattended. There's also information about our attendance policy, and again, based on the nature of our business, it's critical that people are they're taking the shifts that they've committed to and that they show up on time. That's all critical. And so there is some examples of how tardiness can impact your pay. So for example, if you're late by 7 to 15 minutes, then you're docked 15 minutes of pay on your schedule. So it's important to accurately record your timesheet. Also, a total of 3 absences in any 60-day period, or a total of 10 absences over a 12-month period will cause us to consider that and evaluate that, and then that may end up in lead to dismissal for excessive tardiness or attendance. Again, it's important to maintain just clear communication with the office if there's a late situation or you're not able to make it. Another example of something that is grounds for immediate dismissal is not calling in or just not showing up to take a shift. So again, it's critical to let us know that you can't make it. On page 23, there's information about the no call, no show, zero tolerance policy. And there's also information about holiday pay and how that works. Depending upon the assignment you're on and your job description and position, will determine whether or not there's qualification for overtime situations or holiday pay. You want to make sure that you understand that, and your coordinator will be able to let you know if there's situations where you're working over 40 hours and you qualify for overtime, or if it wouldn't qualify, and that gives you an opportunity to choose whether or not you are able to accept that assignment. There's also information about orientation pay, and there are times when you may be required to attend different types of orientations, and there is a payment process for that. So you will be covered for your time on that in accordance with the guidelines in the handbook. On page 24, there's information about vacation policy and how you accrue vacation and PTO time. There's also information about insurance, and there's a referral program, bonus program for referrals. On page 25, there's information about OSHA and infection control, and so you want to make sure that you're very familiar with that. Probably one of the biggest issues is on page 26. It gets into talking about hand washing, and that's a major major way to prevent the spread of infection. So really critical piece there. On the bottom of page 26, there's information about what to do if there's a client, or if you have an accident or an injury, if there's a slip or a fall, anything with the patient, whether it's you. It's critical to report that immediately to the office, because we want to be in quick communication with the patient and their family when there's a situation, however minor it may seem, to make sure that we're proactive in our communication. And again, you contact the office, a member of our team will handle that communication, so you don't need to contact the family members directly. You can again focus on just providing that patient care. On page 27 through 29 is information about HIPAA and other privacy laws and confidentiality laws that we have to adhere to, so you want to be familiar with that. There's also some signature forms that confirm that you will comply with OSHA, HIPAA, any kind of safety requirements that we must adhere to. On page 31, there's an acknowledgement for safety on the job. And again, we want you to have a workplace where you can feel safe, where our patients are safe, and it's a good healthy environment. So we just expect that you'll adhere to those standards. On page 32, there's a little more detail about what to do if there's an injury and how to report that, so that we're able to handle the workers' comp issues and just report any of those issues again to family members if it's a family member, workers' comp situation if it's a situation that you might be dealing with. On page 33, there's information about medication administration, and again, if you're a CNA or an aide, you're not a licensed practitioner who's able to administer medication, so you just want to make sure that you honor that. On page 35 and 36, there are some additional details about neglect and abuse that give some specifics that will help you to recognize when there might be a neglect type of situation going on that you'd want to report. So, for example, if you observe obvious malnutrition or dehydration symptoms, if there's torn, dirty clothing, apparent weight loss, bed sores, things of that nature, those are signs that there may be some type of neglect going on, and you could report that to a member of the team, and then we'll handle that appropriately. With abuse, you might notice bruising, any kind of acute chronic physical illness, pain to the touch, anything of that nature, burns, broken bones, things of that nature. You'd want to just report those to our team so we can follow up as appropriate on that. Same with signs of sexual abuse or psychological abuse or financial abuse, any of those things that you might observe. Again, we're really committed to providing a high level of professional service that respects our patients and allows them to have a situation of care and level of quality life. So there's information on page 37 about what to do, phone numbers to call regarding elder abuse. And then on page 38, there is an employee handbook signature page, and when you sign that, basically that states that you have read and you understand what's in the handbook, and be sure to let us know if you've got questions, anything you're not clear about, because we're committed to our patients and we're also committed to your success. And again, we are excited to have you on our team and welcome you to Malone Healthcare Solutions, and look forward to working together and fulfilling on our mission.